Every year, millions of us, or our parents, go in for those routine health checkups. We do it because we think we're being safe, right? Playing it smart. But what if I told you that some of the most common medical tests, the ones doctors often order without a second thought, could actually be causing more harm than good? It's a counterintuitive idea, but let's dive into the science because it reveals a hidden and pretty shocking truth about these procedures. I know, it sounds almost unbelievable. Can a simple test really be bad for you? Well, recent studies are showing that for seniors, a stunning 37% of medical tests can kick off a domino effect of unneeded treatments, serious complications, and nasty side effects. So today, we're going to count down the top 5 biggest offenders, starting with one that seems about as harmless as they come. Coming in at number 5 on our list is the bone density scan. It's super quick, totally painless, and it's designed to do one thing: detect osteoporosis. But here's the catch. The real risk, especially for folks over 70, is that it often flags just normal age-related bone loss, which then pushes them toward powerful medications they might not need at all. So you might be thinking, what's the payoff for taking these strong drugs? Well, this slide really puts it into perspective. Get this. After 5 full years of taking medication for just mild bone loss, your actual risk of a fracture goes down by a measly 0.3%. That's it. That is an incredibly tiny benefit when you start to weigh it against the potential side effects. And this is where we see the real human cost of it all. Take Rose, a 76-year-old piano teacher. Her scan showed some mild bone loss, so 3 months into taking the prescribed medication, she developed severe side effects that kept her from her passion, her piano. You see, the treatment wasn't really for her. It was for a number on a screen. Okay, so what's a better way to go? Well, this slide lays out a much safer and frankly more effective approach. We're talking about focusing on nutrition like vitamin D and calcium to build up that bone material. Then you add in weight-bearing exercises to actually increase bone density. And finally, you work on balance to prevent the falls that cause fractures in the first place. Studies show this kind of approach can slash fracture risk by over 20%, all without the risky side effects of medication. All right, let's move on to test number 4, the brain MRI for mild memory loss. Now, the goal seems totally logical, right? Find out what's causing the forgetfulness. But the risk here is huge. These high-tech scans almost always find little abnormalities that are actually just normal parts of aging. And that can kick off a whole cycle of fear and a bunch of unnecessary invasive procedures. This chart really breaks down what these scans are actually finding. And wow. Just look at these numbers. For seniors who have some mild cognitive complaints, a staggering 97% of their brain MRIs show things like a little bit of shrinkage or some white matter spots, which, it turns out, are perfectly normal parts of getting older. Only 3% of the time does the scan actually find a condition that can be treated. And this isn't just a statistic, this is what happened to George. He's 74, and he was a little worried because he kept misplacing his keys. His MRI showed these completely normal changes, but the way the report was written sent him into an absolute panic. He became convinced he had dementia and just withdrew from his life, all because of a finding that was pretty much meaningless for his actual health. A much better first step is a simple cognitive screening test. We're talking just pen and paper. It's cheap, it's really effective, and it completely avoids that high-tech panic an MRI can cause. And as you can see here, it's often combined with a good, thorough look at lifestyle factors, like sleep and hydration, which can have a huge impact on memory. This gives a far more useful and holistic picture of what's going on. We're halfway through our countdown, and at number 3, we have the cardiac stress test. If you go to the doctor and complain of being tired, this is often a go-to for checking for blocked arteries. But here's the big problem. For older adults who don't have clear cardiac symptoms, its accuracy is surprisingly low. A 40% false positive rate. I mean, just let that sink in for a second. That means that nearly half the time, this test says there's a problem when there isn't one. It's like flipping a coin and having it come up with the wrong answer. This high rate of false alarms pushes countless seniors towards invasive procedures like angiograms and stents that they just never needed in the first place. And this is exactly what happened to Raymond. He's 75, and he casually mentioned to his doctor that he got tired walking up hills. Well, one just-to-be-sure stress test led to a stent procedure. Then he had a bad reaction to the dye they used, developed kidney problems, and ended up spending 6 days in the hospital. And his fatigue, by the way, it never changed. It was never a heart problem to begin. So what's the right way to do this? Well, the expert recommendation is crystal clear.
Save the stress tests for people who have classic cardiac symptoms, like chest pain when they're active. For vague issues like just feeling tired, a simple resting EKG or even a low radiation calcium scan are much safer and way less likely to send you down a rabbit hole of unnecessary interventions. And now for number 2, and this is one that might really surprise you, the later life colonoscopy. I mean, the goal is noble, right? Screen for colon cancer. But the official guidelines are actually changing because after the age of 75, the risks from the procedure itself can start to dramatically outweigh the potential benefits. Let's just look at the raw numbers here. For every 1,000 colonoscopies performed on people over the age of 75, just 2 lives are saved from colon cancer. Okay, 2. Keep that number in your head as we go to the next slide. And here is the other side of that coin. For those exact same 1,000 procedures, 20 people will suffer a serious complication. We're talking about things like major bleeding, bowel perforations, or dangerous issues from the sedation. That is a 10-to-1 ratio of risk versus benefit. It's a truly staggering trade-off when you see it laid out like that. So what do the experts say? Well, the guidelines are very clear. The U.S. Preventative Services Task Force now recommends stopping routine screening at age 75 for most people. If screening is still something you want to do, a non-invasive at-home stool test is a much, much safer option. It just checks for tiny amounts of blood. Best of all, no prep, no sedation, and absolutely no risk of perforation. And that brings us to our number 1 most dangerous checkup for seniors, the full-body CT scan. You see these marketed all the time by private clinics as the ultimate preventative tool to catch cancer early. But the reality? It's a massive dose of radiation with an extremely high chance of a dangerous false alarm. To really understand the radiation risk here, just look at this comparison. A single full-body CT scan exposes you to the same amount of radiation as about 500 chest x-rays. 500. That is a significant, heavy dose of radiation, especially for an older body to handle. And now, for what might be the most shocking fact in this entire explainer. Recent modeling suggests that the huge increase in CT scans may now be responsible for up to 5% of all cancers in the United States. As you can see on this chart, that puts these so-called preventive scans right on par with alcohol as a cancer-causing factor. Think about that. The very test that's meant to find cancer may actually be causing it. So it all leads us to this final, really crucial question. In our age of high-tech medicine, we're all trained to think that more testing, more data is always better. But as we've just seen, sometimes the smartest, the safest, and ultimately the healthiest choice is to pause and ask, is this test really necessary for me? When it comes to your health, maybe it's time we all started to consider if less truly is more.